Hello, I'm Kathleen Brady. I want to thank you all for attending the Start HCV Symposium in New Orleans and remind you to fill out the survey that's attached to this email. I'd also like to just leave you with a few key takeaways from the symposium. Hepatitis C is the leading cause of preventable deaths due to infections in the United States, and HCV is particularly common among baby boomers. The incidence of HCV infection is increasing among young individuals who use injection drugs. Screening for HCV is now recommended for all people born between 1945 and 1965, regardless of risk factors, and for all persons who have injected drugs. All persons with chronic HCV infection should be considered candidates for what is now curative HCV treatment. In terms of screening for HCV, increased screening can improve clinical outcomes and decrease transmission. We really need more programs that are focused on clinician training about HCV screening and treatment options. And we also need public information programs that are focused on decreasing the stigma and increasing knowledge about these rapidly evolving treatment options for HCV. We need consistency in insurance and Medicaid coverage for testing and treatment. And finally, HCV treatment is recommended for nearly all persons with HCV infection. There are multiple, highly effective oral HCV treatments that are currently available, and the cure rates exceed 90% in the real world and among persons using drugs. Elimination of HCV may now be possible, but it will require prioritization of screening, linkage to care, and treatment. Thank you very much for attending the symposium, and I hope you've all benefited in some way that you can use in your practice tomorrow.